Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today there are no new cases of COVID-19 to report. The total number of cases remains at 289. As of this morning, 3 individuals are hospitalized with 1 in intensive care. As of this morning, 254 individuals are listed as recovered. There are 28 active cases. As of yesterday, an additional 814 lab tests were performed. That brings the total to date of 33,045. With the long weekend coming up and nice weather ahead of us, many people are thinking about heading out for the long weekend, heading to a campsite or to the cabin this weekend. So remember to remain COVID careful, to ensure you're bringing adequate supplies so you don't need to make unnecessary steps. When you are in these campsites or at the cottage, please continue to abide by the 10-person gathering rule to limit your exposure to others, to maintain physical distancing whenever possible. And again, as we move forward, it's vital not only this weekend or not only when going to the cottage or cabin, but it's vital to not be going out when you're ill. So certainly seek health care, certainly seek testing, but we can't have people heading to campsites or to the cottage when you're ill. This is especially important because it could put extra demands on smaller healthcare systems in those areas. But we know that the transmission of this virus is predominantly by those who are showing symptoms. So it's important as we move to reopen our economy, as we're moving closer to phase 2 of our reopen strategy. People need to be aware that you can't be showing up to work when you're ill, even with mild symptoms. You can't be showing up to school or out shopping or meeting other people when you're ill. We need people who are ill to stay home and certainly seek health care if required. So as we continue our cautious reopening of the economy, we're continuing following our numbers, and they're continuing to remain favorable. We will look to further loosen public health restrictions as we get closer to June. And that could include things like group size allowances. But we have to do it cautiously and gradually to ensure that we don't get a reversal of our progress to date. We have increased our testing capacity. We have expanded our access to testing as well as the testing criteria. So again, Manitobans that are showing symptoms of respiratory illness, fever, cough, runny nose, sore throat, present for testing at one of our sites. We don't need to call ahead or call to HealthLinks for a referral. So I'd encourage all Manitobans with symptoms to be tested. It's an important part of our reopening strategy to ensure we're identifying cases early, having them isolate, and doing our typical contact investigation and follow-up. As our numbers remain favorable in Manitoba, that does leave us susceptible to importation of the virus. So the travel, the need to self-isolate for 14 days for those who are returning to Manitoba is essential at this time. We need to avoid the importation of this virus from other jurisdictions that are still battling rises in this virus. Manitobans are well aware of the precautions that we need to take in general, and as I mentioned, the most important one is to be staying home when you're ill, even with mild symptoms. Washing hands frequently washing, disinfecting frequently touched surfaces, and physical distancing. As much as possible, we need to stay those 2 meters away from people that are outside of our household. And that also includes reducing any personal non-essential travel. Our messaging is slightly different to those that are at increased risk of the severe outcomes of the virus. So those who are over 65, those who are with underlying medical conditions, especially respiratory or cardiac conditions, those with immune compromise need to be extra careful. Need to ensure physical distancing at all time, should limit limit exposures to others. Frequent hand washing is important. We know that many of the severe outcomes of this infection is occurring in those listed high risk categories. Businesses that have questions regarding the orders should engage or contact engagemb.ca for more information, and manitoba.ca COVID/COVID-19 is an excellent site for up-to-date information on this virus. So thank you again, and I'll pass it over to Lanette.
Thank you very much. I'm Lanette Siragusa from Shared Health, the Chief Nursing Officer. And I want to start by thanking all Manitobans who have reached out to support healthcare workers throughout the past couple of months. Your words of encouragement, your acts of kindness, your works of art, musicians playing outside the facility, parades, have all been wonderful morale boosters for our clinical staff. And so too is the donation of food. So we've had many restaurants show up at the facilities and donate foods, drop off meals for staff, and very much appreciated. Today I wanted to give a special shout out to From Our Kitchens to Our Heroes program, which has provided 1,500 meals to hospital staff in Winnipeg over the past month. And these meals are made by restaurants that are owned and operated by immigrant and refugee families from throughout the city. So it's a lovely gift from these families that our workers have greatly appreciated. So thank you very much for that. I would also like to give you an update on the health of our frontline staff. To date, or I should say since April 10th, we began identifying who our healthcare workers were that were getting lab tests. And since April 10th, we've done 3,584 tests on these workers. It also includes first responders. In the past 7 days, we tested 462 healthcare workers and first responders. One has come back positive, so our total number is 26 now. I'm really happy to report that 25 of the 26 healthcare providers have recovered from the virus. And this new case that was identified this week is from Prairie Mountain Health and is not related to the cluster of cases that is occurring in the region right now. So I just want to thank the healthcare workers for their ongoing diligence to protect themselves and others from the virus. And it's good to have you back all at work, or most of you at work, except one. The testing sites. So we are pleased to see an increase in the number of Manitobans who are showing up to the testing locations. Yesterday especially, we had a good number. As a reminder, you no longer need to call HealthLink's Info Santé before being tested. If you have symptoms, you can go directly to a testing site. And as we head into the long weekend, important for you to know that the community testing sites will remain open at many of the spots throughout the province on Saturday and Sunday. We encourage anyone who is experiencing cold or flu-like symptoms to visit their nearest community site for testing, but to first check the hours of operations before you head out. So you can go on to www.gov.mb.ca/COVID-19/locations, and that will give you the most up-to-date. So Monday, though, which is the statutory holiday, the Sergeant Tommy Prince testing site and assessment clinic will be open, as will the Bison drive-through, as well. Winkler and Selkirk will be open. The other locations throughout the province will be closed on Monday. I can also announce that a new testing site is going to be open on Tuesday, and that is the Thunderbird House. That will be open to all individuals, including those who experience homelessness. So as we do with all testing sites and public health, is we make sure that the alternate isolation accommodation sites are accessible for whoever needs them. And if they need a safe place to isolate while they're waiting for their test results, we will make sure that is available. And so we would like to thank everyone who's contributed to making the Thunderbird House accessible and ready for Tuesday, and that includes the Aboriginal Health and Wellness Center, the Manitoba Métis Federation, and the End Homelessness Winnipeg group for their assistance in making this project a reality. And so just like Dr. Roussin had mentioned that the long weekend, it's important for our staff to get away and our public to just relax and enjoy the weather and the Manitoba springtime. But do remember that the 14-day isolation is required if you go out of province, and non-essential travel is not recommended. So if you can stay close to home or in those border communities, that would be appreciated. And everyone's doing a great job keeping those numbers down. So thanks to everyone, and have a good long weekend, and we can open up the line to questions.
Thank you. A reminder to our reporters online, you will have one preliminary question and one follow-up question. Up first this afternoon from CTV Winnipeg, Michelle.
Hi, it's Michelle going from Winnipeg. This is the first results that we're getting from the people no longer having to go for a referral. I got 0 cases. Is that kind of what we were expecting, or what does this tell us, if anything?
Yeah, I think we definitely want to have the testing numbers up. I think it's an important part of the reopen strategy. But yeah, I think that as we progressively open to the less and less at-risk individuals be tested, then we're going to expect our positive test rate to go down. And so that's what we're seeing with this. And then that indicator is going to be a very good indicator if we should start seeing that virus circulating again. So that's something that we're following very closely.
Thank you. Are there any updates on if any First Nations people or people living on First Nations have tested positive?
So there hasn't been any positive tests to date on First Nation communities. I believe our partners, our Indigenous partners, AMC, will be doing a media release on the self-identified numbers, but I can communicate that there are no positive tests in First Nation communities to date.
From City News, Stephanie.
Hi there, Stephanie Lasuk from City News. Doctors, and there's been some concern over health and safety in a food processing plant in Manitoba. I'm just wondering if the province is looking to stepping up inspections, just knowing what we know about outbreaks in other parts of Canada and food processing plants, or if there have been specific guidelines put in place for these plants.
Yeah, we've had a lot of public health involvement with that industry. We have a lot of guidelines that are in place to limit the introduction of that virus into those facilities, and we're still working on having many sector-specific guidelines being available to various sectors. But yeah, we've been heavily involved in trying to reduce those type of introductions of the virus into those what we see from other jurisdictions, certain high-risk areas.
And how many inspections has the province actually performed in food processing plants like these? Have we gone in and checked them out?
Oh, yeah, I don't know about numbers of that. You know, our work in public health has been working with with the companies, providing them guidelines. They're certainly all quite interested in being safe at this time. So guidelines on screening employees and other type of protective guidelines are what we've been working with.
From the Winnipeg Free Press, Larry.
Dr. Roussin, we understand that some 16 First Nation people living outside of reserves in Manitoba have self-identified and tested positive. 16 First Nations people living outside of reserves. 14 of those are in Winnipeg. Are you surprised at all by the numbers? Are they lower or higher than you would have thought?
So I sure wouldn't say surprised. What we knew is that when we started preparing for this pandemic, we knew that certainly the remote, isolated communities, First Nation communities, were certainly at high risk of severe outcome should the virus be introduced there, and we know this from from other communicable diseases. We learned from H1N1 in 2009. So that's where we had the focus. Certainly, there's a large proportion of the population is Indigenous, is First Nations that live off of those communities. So we would certainly expect a certain proportion of the cases outside of the communities to be Indigenous. So numbers don't really surprise me, but I think it was a great partnership. That information sharing agreement it was a great step to be able to have these numbers and to be able to follow them.
And the fact that there have been no cases on First Nations in Manitoba, is that something that up until now, is that something that's been a surprise to you that is not spread there?
Yeah, I wouldn't frame it as a surprise. I think that really early on we started working with the First Nation partners, and just showed a terrific leadership in those communities to be on top of this, and many measures were put in place to protect people in those communities. And so I surely wouldn't frame it as surprised, but certainly it was the goal we're after, and we're not out of things yet. We still have the northern travel restrictions in place because of that. We're still heavily engaged with our First Nation partners because of the increased risk there. But certainly to date, this was what we were really planning to do.
From Global, Marnie.
Good afternoon, Marnie Blunt from Global News. Dr. Roussin, there still seems to be a bit of confusion about what's acceptable and what's not heading into the long weekend. We're still saying avoid non-essential travel if you can, but if you do go, here's what you should what you should do. Can you just provide some clarity on that and whether it's acceptable to gather and how people can do that? Should they only do it with two different families? Should they have zero contact? Can you just provide some clarity on that?
Yeah, and I mean, I think that the issue here is the difference between the orders and the difference between what's guidance and what are suggestions, and then there's different application for people who are high risk of severe outcomes. So certainly the public gatherings are not going to be allowed with greater than 10 people. So those are orders that are in place right now. And really the heading out to the cottage, heading out to the campsite, you want to be careful, and it's really important that people who are feeling ill in any way not leave their home. If you do go, then things like hand washing and making sure you're socially distancing, not getting in large groups with other people. If you are with other people, and outside is even better. Keeping that 2 meters difference is better. So we're not done with this virus. Our numbers are looking favorable. So we are moving to reopen the economy. So our message to the majority of Manitobans is not stay home now anymore. It's stay safe. But certainly those who are at increased risk of severe outcomes, we still have the message of stay home for the most part. So those over age 65 or underlying medical conditions or immune compromise, we still want to protect those people who are susceptible to severe outcomes.
Thank you for that. And kind of adding on to that note, it's supposed to be a nice May long weekend. Patios are open and people might be planning on gathering and heading out to patios. Any advice for people that plan on going out to a public place like that and being among others?
Yeah, so same things kind of apply there. So if you're feeling unwell in any way, or any group of your a member of your party are feeling unwell in any way, then certainly that shouldn't occur. If you're heading out on a patio, public health advice is when you're sitting at a table, ideally that's people part of part of the group that you normally live with. Certainly that's not an enforceable thing in the order. But that's the advice. The more people you spend close, prolonged time with, that's a increasing the risk of transmission. So certainly Manitobans have worked hard. We're seeing these favorable numbers. But as we continue to reopen, there's certain cautions that Manitobans can take while still trying to get out, while still trying to enjoy times, while still getting out to patios. There's still cautions you can take, and if Manitobans continue to follow that, we'll see that we'll continue to be able to loosen our strategies.
From the Brandon Sun, Bud.
Yes, Governor Robertson, Brandon's son. Lanette, would you be able to elaborate just a bit on the positive case you alluded to in Prairie Mountain Health, such as, is this a healthcare worker or a first responder? And if it's a healthcare worker, could you tell me what kind of facility this is or was?
I can confirm it is a healthcare worker, not a first responder, and that's all the information I have at this time, Bud.
Okay. And Dr. Roussin, are you aware of any instances where public health officers are refused entrance to premises they want to inspect? But if it does happen, what recourse would they have?
That's right, and that does happen. I'm aware of some situations. So the Public Health Act allows a medical officer of health to enter facilities given certain circumstances, and if it was felt necessary for the health of the public to do so, then they could engage with a peace officer to help with obtaining entry into that facility.
From CJOB, Diana.
Good afternoon, Diana from 680 CJOB. Ms. Siragusa, Shared Health will get monthly financial updates on what money has been spent and what is still to be spent. Has Shared Health kind of underspent? Is it on budget or has it overspent? And can you kind of give us an idea of how much money has been spent now, dollar-wise, with respect to pandemic-related costs?
I'm going to have to get back to you on the details of that. I don't have it readily available right now.
Okay. Are you able to kind of give maybe an anecdotal breakdown? Obviously, PPE is a really big cost. It's been highlighted a lot. But we've heard there are kind of fewer people in hospital getting treatment for non-COVID related ailments. Are there areas you're able to point to where any things that have been spent a little bit more on?
Certainly, in terms of services, some services have decreased, like surgery and our outpatient clinic. But a lot of the spending that happens there is related to staffing, and a lot of our staffing have been redeployed to other areas like the screening clinics, occupational health, health links. So it's really moving around our resources so much as saving money for sure. The other thing is we have been making significant investments in virtual solutions, spending money on, well, we've been given the gift of donations in terms of advertising and communication for COVID-19. So I can find out what the surplus or deficit is, but off the top of my head, I'm not sure what, I don't have those numbers.
From the Winnipeg Sun, Scott.
Hello, Scott Billick here from the Winnipeg Sun. I have a question about the 3D printed masks. I think they're, what is it called, the Petropolis mask, I believe. So they've got, I'm just wondering, they've been, I guess Shared Health is looking to get an exemption for these masks to be used in surgery. And operation rooms and that sort of thing. But they don't, and the exemption would be for not having received NIOSH or equivalent verification. Why did the province order these masks, given, I guess, the limited evidence that they're, I guess, safe, I suppose?
Mm-hmm. That's a really good question, and I can tell you as of this morning, there's a lot of processes that go into making sure those masks are safe for our staff, and the last thing we want to do is not follow the right processes, do the right tests, have the right data. So there were lots of steps to go through. Those steps have been completed, and Workplace Health and Safety today, I was notified, have approved that those 3D masks from Dr. Petropoulos have met the criteria, the safety criteria, and they will be provided as an option to operating room staff throughout the province. So in answer to your question as to why did they start making them before it was approved, I would guess because they were optimistic that it was looking really positive. The fit testing, all the criteria that they would go through, can people breathe and talk, and with the masks on, all those were looking very good. We just had to really go through the formal process of approval.
Okay, thank you. And my follow-up is, I guess for Dr. Roussin, the U.S. and Canada border closure is set to expire, I think, next Wednesday, if I'm not, Thursday perhaps. Is there a need to extend it right now? And I've been hearing that there's a 1-month extension in the works. Is that coming at some point, or will that be announced before next Thursday?
Yeah, so that would be under the federal jurisdiction, under the Quarantine Act. And so, given the difference in the epidemiology right now between Canada and the U.S., I do think that that's something that should be extended. Certainly in Manitoba, one of our biggest risks right now is importation of the virus. So we do need to limit the ability of that virus to enter our province from other jurisdictions. So that will be up to the under the federal jurisdiction on those border limits. In Manitoba, certainly we'll be enforcing a 14-day self-isolation for the foreseeable future to anyone returning to Manitoba.
From CBC Radio Canada, Mohammed.
Hello, my question is for Dr. Roussin. I think it's Mohammed from Radio Canada. There are some expectations around reopening of schools in September. That includes the matter of personal protective equipment for staff. I think that you had a meeting with board chairs and other education stakeholders yesterday. What did you tell to them?
Yeah, and so we didn't have any details on what things would look like. Public Health is working with the department on how we could implement a safe return at that time. And then we were talking about most of the things that we discuss here is the importance of when they return, that it's going to be vital that there are policies, strict policies in place that won't allow children with symptoms of respiratory illness to be at school, and that it would apply to staff as well. Things like how physical distancing can be improved in schools, and things like disinfection and things. So those are the type of the basic things. The details are going to be worked out over the next little while. In any setting that we're at, it's going to really come down to those basics of this viral transmission. And number one is that we need to change the way we do things, and it's not going to be okay for people to show up to work or to school even with mild respiratory symptoms.
Thank you very much, and I have no follow-up today.
From CBC Manitoba, Aiden.
Hi, Aiden from CBC Manitoba. Dr. Roussin, just to look back to gathering sizes, we've heard from the Premier that we may see an increase in this in mid-May, and so I'm wondering when we might hear an update on that, and if you have any idea what the new maximum for group gatherings might be.
Yeah, so we definitely said that mid-May we're going to look at our numbers and really consider that, and that's what we're doing right now. I don't have any details on on a plan. So certainly, if things continue the way they are, then coming for phase 2 June 1, and we'll certainly be increasing that group size. The details of it we don't really have right now, and we'll be able to discuss more on that. We discussed, is it possible to increase that group size before June 1, and it is. We're looking at that. The issue right now is that we're sort of mid-May. We're just sort of one incubation period away into our reopening strategy. So it's too early to put too much weight on these low numbers. In the next week or so, we're going to get a better idea on if there is any effect on our reopening strategy, and then we'll continue to look at it.
Thank you. And my follow-up is, can you give an update on how busy Manitoba ER is right now? I know earlier in the pandemic we heard that there were some low numbers, and just wondering if there's been any change on that front.
Yeah, I think they are picking up a little bit. They're not as busy as what our typical numbers would look like. We also are seeing the surgery beds becoming more and more occupied as we begin to ramp up those surgery volumes, but still lots of capacity in the system. So we would encourage anyone who has any medical issues to either call HealthLinks or go to the emergency if you feel you need that care. There's space, and they are there to serve, and they have made sure that all the screening criteria and physical distancing is set up for a safe visit.
Thank you. We have a few minutes left, so if our reporters online have any follow-up questions, please proceed now.
Dr. Roussin, it's Bud from the Brent Roussin. A reader posed this question. Perhaps you could speak to it briefly. What was the reasoning behind not allowing people to go north above the 53rd parallel, and yet people from the north can come south and then return home after possibly picking up COVID down here and then taking it back home with them?
Yeah, and it's a lot of these things are balances, right? And so we wanted to do what we could to limit non-essential travel up to the north. We wanted to reduce the chances of that, but then we also didn't want to, limit the ability of people to return home. So we certainly advise against non-essential travel. So that advice applies to people who live in the north. Our advice is to stay near your home community. But we didn't want to be in a situation where there are people who are living in the north who found themselves in Winnipeg or somewhere in the south that now could not be able to be allowed to get back to their home. So it is a balance. It's ideally we strongly advise against that non-essential travel right now.
Thank you very much.
Dr. Diana Fitzpatrick from JOB. Question for Ms. Siragusa. Manitobans have started beating a dead horse on this, but Manitobans have been asking us at Global News for numbers on what we are spending during this pandemic. Can you commit to kind of giving us the latest update at some point?
Yes, I can do that. With the COVID spending, it does come from different areas, but I can certainly look into what I can find and provide you with some numbers.
Thank you very much.
Hi,
Dr. Roussin from Winnipeg Sun. I got a question. Just going back to, you spoke that you've heard some businesses that have refused potential, public inspectors. Is there a reason why maybe the province wouldn't name those businesses? I assume people wouldn't want to be going to businesses that are refusing public inspection.
Yeah, it depends. I think that on the health protection website, if there's any fines issued to certain businesses, they do publish it there. So if there's a public health need to disclose things like that, then it is found online.
Hi, Aiden from CSU. I just want to go back to the case numbers today. Just looking at the demographic data online, it looks like there was +1 cases in the Winnipeg males 40 to 49 and -1 cases Winnipeg males 30 to 39. So was that just, can you just clarify, was that just a data error, or is there like a net zero cases where one was added and one was reduced?
Well, I know there was a Winnipeg case that was formerly a probable case that was removed in early May. And then there was another confirmed positive case there. So that's where we fell with the WRHA.
Dr. Roussin, Marnie Blunt from Global News. Just going back to my earlier question about patios, obviously tables are supposed to be properly spaced out for social distancing. But when it comes to who you're sitting at the table with, is it okay for people to gather around the table with people from a different household, or what's your advice on that?
Yeah, so it's a good question. So again, the order doesn't prevent that. So certainly restaurants aren't being put in a position to determine who's from the same household. So what we want to do is we're reducing crowding on those outdoor places, the 50% capacity. Our public health advice is that, if you're sitting at a table, ideally, you're not going to be able to physically distance that whole time while at that table. So that table should be people from your household. Now, that's not enforceable. This is public health advice, but that's where we're at this point.
Hello, Canada here. It's Dr. Roussin. The current state of emergency comes to its end on May the 18th. Do you know if it will be extended?
Yeah, I don't have details on that. That's not I deal with the public health orders, and so we'll be looking at those and making announcements with regard to those. But I'll leave the announcement of the emergency orders to government.
Hi, Scott Billick again. Just wanted to ask Lanette a follow-up question from my first one about the Metropolis map. Just looking over the exemption here, it does say that workplace health and safety is not a certifying agency. So I guess I'm unclear as to why the province would purchase the masks without assurance that these masks are safe and get certified. I suppose that is the question.
Yeah, so they are approved by Workplace Health and Safety now. The testing and the evaluation has been going on for several weeks, and it has been looking very positive. So I assume that the decision was made because it was looking so optimistic and probable. So they got to work on putting those into production.
Okay, thank you.
Hi, Aiden from CBC News. Dr. Roussin, we heard from at least one business, in this case it was a garden center, and they're actually closing their doors this weekend because they've had cases of customers who are yelling at or even touching staff members due to some of the limitations. And so what's your advice for businesses that are put in that position where customers aren't abiding by the rules?
Yeah, I mean, it's the business is it's a private facility who can make policies, and so if they felt unsafe for some reason, then I think they should follow a normal process and call authorities if that was. So the public health will provide the guidance for them. How the company will go about enforcing it is going to be up to that company on what they see fit.
Dr. Roussin, Diane here from CJOB. Just quickly, I know you said earlier that gyms are allowed to hold classes outside with very strict restrictions, certainly distancing and bringing their own equipment, no more than 10 people. What is the situation if someone were to book, say, a personal training appointment one-on-one inside the gym? That is still not allowed, correct?
That's right. So the inside fitness training is not exempted on this order at this point. Certainly outdoors, that would work, given if all the other guidelines were followed. But at this point, no, indoor personal training is not allowed.
Thank you. And this concludes today's media briefing.
Thank you.
Thank you.